Good afternoon, everyone. I'm Mayor Connie Boyer, and we wanted to give our community an update on what's happening with COVID and vaccines. And so today we have several people with us. We have Krista Estel, our public health nurse, Dr. James Trent, Penny from Grassley's office, Dee Sandquist was one of our supervisors, and Brett Farrell of our emergency management. So we're going to start off today with Dr. Trent, and can you give us an update from your perspective?
Thanks, Connie. It's been a unique time, as always. We are currently still seeing COVID, but probably not as strong as it had been back in November. November is kind of when I think we saw the surge, really mainly in Iowa, but it's not to say that COVID is completely taking a break. We are, at least in my experience, of seeing fewer cases of COVID necessarily in hospitalizations. However, we are now following or noticing that there are new variants that are coming out from COVID. There are 3 strains, specifically one from the United Kingdom, the B117 strain. There's also a strain from Brazil and another one from South Africa, which potentially all could be transmitted more easily, as well as potentially have greater effect in terms of causing severity of illness. It's not really well understood whether or not the new vaccines that are come out are going to necessarily protect from this. However, there will be continued surveillance on this issue as these new variants have come out just only within the last month and a half. This still underpins the fact that we are encouraging those that are able to get vaccines to get vaccines. I have been able to get both of my vaccines simply because of my line of work, working in the emergency room, and others will also continue to be rolling out. This probably is going to be much slower than we had hoped for, I think, in terms of vaccine rollout and distribution. And I'll let Chris talk about that more specifically for our county. But if you're able to get the vaccine or eligible for it, we certainly encourage you to get the vaccine, both doses, so that you might be able to be protected, so that you can continue work that you're doing, especially those that are in frontline work in healthcare, et cetera. Also, we are continuing to encourage, as always, use of masks and good hand washing. Consider the mask to be something that you can help others with, or out of consideration for others, I should say, that they might be able to be protected from you potentially if you were ill. The mask is known to be very effective in this way, and we continue everyone to be able to mask up. I know the CDC has recently come out and required that in public transportation settings and other settings that masks must be worn, but not only in should you consider wearing masks in these settings, but also masks in other settings at stores and other places that are requiring them, and try to be compliant and thoughtful of others while wearing masks. You can certainly decrease the amount of spread of illness by using one, but also through good hygiene practices with hand washing, as well as social distancing, planning your trips to markets and other things that you might have to do. Even though 2020 is behind us and we're grateful for that, 2021 may be just as challenging, and especially these new variants that come out. So continue to watch for developments through the IDPH website and CDC and other reliable sources that you might be able to monitor the changes that might be going on, because they do change from day to day. So keep it up. We got to get through 21, got to get people vaccinated, and hopefully we will continue to see the decrease, but potentially could increase if these new variants become widespread and cause increased illness.
Hey, hi, Connie, you're on mute. Sorry, you need to unmute yourself.
Oh, sorry, I forgot. I wanted to clarify, because I read an article last night about these variants and the vaccine. It was suggesting to do the vaccine because it would, as more people got vaccinated, it would stop the variant from spreading. Is that Is that the way you understand it, and the vaccines will help that, or is it just a matter of it will stop spreading, so it'll stop mutating?
Well, I think enough of these variants have still enough in common with what we're being vaccinated with that you would have some protection. So we are still absolutely encouraging people to be vaccinated, because certainly that would do that, help reduce spread. But again, it's still early days. I mean, we only know the variants have been, I think, identified just back in December or so. And so hopefully, and there's been some evidence on both sides whether or not this is going to be something that's going to be able to attenuate or to stop the spread of the illness. But our hope is that it will continue to do so as people get more and more people get vaccinated. But that's the key, is more and more people get vaccinated so that they're able to hopefully stop the spread of illness.
Great, thank you. Chris, can you tell us what's happening on the vaccination side?
Hi, yeah, thank you, Dr. Trent, for joining us. First, I just want to say that our hospital partners were going to join us as well. They were invited, and Brian Hunger was unable to join us today, so I just want to address that. Sure, I'm Chris Estel, I'm the Public Health Administrator. First, I want to thank everybody for being kind, courteous, and understanding through this very, very, very challenging time with the masses meeting criteria for vaccination. Anyone 65 and older now may receive the vaccine. You do not have to be experiencing a comorbidity or another underlying health issue. And then in addition to that, phase 1B, there are also 5 tiers. And the first tier is our school partners. So that in and of itself is a large demographics of people that need to be vaccinated. Vaccine rollout has been very slow. And that is because it comes from the federal level to the state level and then redistribution to us. It's the state uses a calculation based on, for phase 1A, it was based on the number of registered licensed healthcare providers in our community, looks at age, demographics, all of those other things go into that vaccine allocation. Phase 1A went remarkably well. We were able to vaccinate direct healthcare providers, first responders, those EMS folks. Most of those individuals that received vaccine the week of Christmas, the week of New Year's, have received their second dose, myself included. So that went very, very well. The issue has become, now that we are following the national guidance, we know that Iowa has a large population over 65. Think about all the baby boomers that you might know personally. This has created a big stress on local public health departments. Right now, the vaccine is allocated to local public health departments, and then it's up to us to reallocate those doses to our community partners. With that being said, I am not given enough doses to allocate now. We are going to in the next several days, anticipate that vaccine is going to be distributed within the community. We are still working with our partners, meaning our hospital and local pharmacies. I think that the key to this, and the key to understanding and how information is disseminated or how information is broadcast, is important. I work with our local radio station, KMCD Classic 96. I go live. We're working with a Fairfield Media Center, Jason and Dick DeAngelis. They've been wonderful to get information out. Our local newspaper, and of course, Facebook. The reason I don't use our website at the county level is because it's very difficult and it's very cumbersome. For me, it's easier to access Facebook and then share a post, and then our local media picks it up and shares it as well. We do understand that there's a portion of demographics that do not have access to any of those things. So we do the best we can to get information out. I want to say that I have not generated a list yet. That has been a huge point of discussion. People are angry because I don't have a list available. The list will become unmanageable at this time. We cannot have hundreds of people on a list and then have those individuals sign up at several different health departments in surrounding counties, which I know is happening. And because then that skews data and numbers for those respective counties. We need to have people be understanding and respectful that eventually everyone will get a vaccine. This process is slow to roll out. Okay, so with that being said, When the health department receives and is going to allocate vaccine, you will be notified through the Facebook page. You'll be notified through the local radio station. We still are taking phone calls for appointments because of what I just said. There are individuals that do not use apps. There are individuals that do not have access to the internet. There are individuals that still listen to the radio. And I want everybody to be given an equal opportunity to call in. Now, I have actually thought about, and I don't know that this is happening, I actually thought about putting all the letters of the alphabet in a hat and drawing out a letter and saying, if your last name begins with this letter, today you can call for an appointment, because vaccine is that in that restricted supply. We are doing the very best that we can. I will tell you, I had a Zoom meeting this morning with our hospital partner, Brett Farrell, our emergency management coordinator, and all 3 school districts in Jefferson County, Pekin, MSAE, and Fairfield. We have those school districts scheduled. Those staff members are scheduled. I'm not going to release the dates of when that is. That's not my information to release. I want you to know that we are working diligently through the tier process. Those individuals will have the vaccine available to them. It will only be for the school employees. It will not be for their spouses. It will be considered a closed pod or closed point of dispensing. Our nurses are going to work with the school nurses, and the schools are responsible for generating their schedule and giving us the locale to administer vaccine. I want to say this: administering vaccine is the easy part. Giving somebody a shot is very easy, and it is the least time-consuming portion of this. The barrier becomes, once you open a vial of Moderna vaccine, which is what we have here, all 10 doses need to be administered within 6 hours. Sometimes you can get 11 doses, and actually we've gotten 12 doses out of a vial before. We administer all those doses. So we might actually call somebody in that maybe didn't want the vaccine, or maybe is on a different tier, so we don't waste that vaccine. So all those doses have to be administered within 6 hours. So it becomes kind of a challenge to administer the doses and then watch them 15 minutes after they receive the injection, then clean the area, and then have them return to school. So it's not just walk through, get a shot, and then walk on by and go back to your job. No, there is a process that is in place, and we have to follow those recommendations in that process. Then remember, in 28 days, we go back and do the same process again, because this is a 2-dose series, meaning you need to get both injections, both shots in this series to get the best coverage. Now, we've had instances where people do not want to receive the second vaccine. There is a criteria. If you've been infected with COVID in the last 14 days, if you've had COVID in the last 90 days, we encourage you to wait until closer to that 90-day natural immunity coverage to receive your vaccine. You cannot receive the COVID vaccine if you have received another vaccination of any type within 14 days. So say you needed to get a tetanus shot because you cut your hand and had to get stitches, that would bump you and delay your receiving the COVID vaccine. Johnson & Johnson is they are going to be submitting soon for their emergency use authorization. So we would have another opportunity for a different vaccine at that point. Again, it doesn't matter at this point, really what we do or how we handle it. It's the demand is greater than the supply. I want to assure you that we are doing everything within our power at the health department to get the vaccine out and distributed as soon as we possibly can. And in the meantime of doing all of that, we continue to answer the phones, we continue to administer vaccine, and everybody has their own idea and opinion, but rest assured, we do know what we're doing. We've gone through many years of training in emergency preparedness. I'm a former ER nurse. I know how to triage a situation. And I think sometimes the frustration becomes that people don't like the answer that I'm giving because we have to wait and we have to be patient and understanding. And I understand that. And I'm very thankful that people do understand. But please, please be patient and understanding. And when in doubt, you can always call us at the health department. If we don't answer the phone live, we have a recorded message that tells you what's going on with vaccine. I know we try hard to answer the phone, but at least our message is reflective of the current vaccine situation. The other thing I want to make sure that I address is the fact that we don't make appointments until vaccine is in our freezer or refrigerator. And people become frustrated with that. Well, logistically, I know what can happen. This is Iowa, this is winter. Shipments may be diverted at the state or federal level. Just because they say I might get 100 doses doesn't mean I really am going to get 100 doses. And shipping might be delayed. I never know when for sure I'm going to receive a shipment. There's always a window of, 36 to 48 hours of when your shipment can arrive. I do not have the capacity, the time, or the resources, nor do I want people to be even more angry if we have to reschedule appointments because the vaccine didn't arrive. So I hear you, I understand, and I feel your frustration. And we are doing everything we can. Anything else, Connie, you want me to address right now?
Great, Chris.
Okay.
Appreciate
that's a lot of information. I try to make it so everybody understands where we're coming from, and we do understand the wants and needs of our community. We do, or we wouldn't be in this job if we weren't trying to do the greater good. So thank you.
Yeah, I think it's, people are just wanting to get it done. And but again, we ask for people's patience because we have to go down the list. And right now, it sounds like the priority is the school personnel. And so the kind of general population is not quite ready. You're not ready for those people yet. So
correct. And I think the one other point is, if you look at the tier 1, which is posted, we were able to meet the need of our first responders, firefighters, and police officers, and school counselors or social workers. We were able to meet that demographics of tier 1. So we're kind of already ahead a little bit. So now the focus is that tier 1, that pre-K through 12 daycare school and those folks in that priority group.
And then the next tier still doesn't look like general public, correct? Do you want to just say who's next after the schools?
Correct. Honestly, general population is not even in phase 1B tier 1 through 5, unless you are 65 years of age or older. So if you're a healthy 30-year-old or 40-year-old and you don't fall into one of the tiers, you're not going to get the vaccine yet. And that's unfortunately the way that is. I do know that I anticipate the federal pharmacy program will kick in. I don't know for sure when. The Iowa Department of Public Health hasn't released that information yet. Please know that we listen to the Iowa Department of Public Health Zoom meetings 2 to 3 times a week whenever they call for those meetings. I do know that our large pharmacies are going to be allocated vaccine directly from the federal level. I don't know for sure when that's going to happen, but again, I anticipate their focus will be on those individuals 65 and older, because they'll still have to follow those priority groups as well. And then on the backside of that, after we administer a vaccine, we have to enter that information, that vaccine information, into the system called IRIS. It is the immunization registry for the state. And then we have to do that within 24 hours of administering a vaccine. And then that helps the state to know if we are administering vaccine, if we have vaccines sitting on a fridge someplace, or if we're waiting to do, like, say we were going to do a big point of dispensing for our community, they want to know that information. And if we're not utilizing doses, which is not the case here, they would reallocate those doses to another county. So now that vaccine information is available on the Iowa coronavirus website, the same website you've been going to, now vaccine information is available on that website too.
And one of the upshots of all of this, Chris, is that doesn't matter what your national news says. That's not our Bible here at this point, right? We need to come down to the local level and get the most important information from you.
Yeah, locally is the best place to get your information, because even city to city, county to county, everything looks different because every county health department is allocated a different amount of vaccine. Every county looks differently. Every county has different support systems in place. Some counties have less staff than I have. So listen to your specific county or city information, because you're right. And I think that's been a frustrating thing too. A lot of people say, well, New York's doing it this way. Well, we're not New York, nor are we California, thank goodness. But again, across the United States, though, everybody wants the same product, right? Everybody wants the same thing. So we have to be understanding that everybody can't have the same thing at the same time, because we don't have enough of that item available. So.
Right.
Thank you.
Thanks so much, Chris. Thanks for what you're doing. And we know you're under a lot of pressure right now. And next up, I guess, Brett, do you have anything that you want to add from the chair that you sit?
I don't have a lot to add. From day one, when we first started this back last February, emergency management role in this was a resource for public health. So I continue to meet and talk with Chris and the hospital and community partners, almost on a daily basis. But as far as an active role, now that the vaccine is rolled out, that's public health's. They're the incident commander of this situation right now, put it in better terms. But we still talk. I will say that the processes that are in place, people are going to argue that they're not working or they are working. Those are constantly being looked at to see if we can obviously help that be better. But it kind of threw a curve at us when it went to 75 years to 65 years. That opened up a huge demographic of people that now are eligible for the vaccine. And being up at public health and hearing the phones ring and while all their staff are on phones, it's not a good thing. It is a slow process. The vaccines just aren't here. We're getting very limited supplies. We wish we could vaccinate everybody within the next 2 weeks. And we've actually talked, my role right now is if we get to the point where we get numerous doses of vaccines, we have a plan in place to move forward with a vaccination center where we could have opened. It's a logistics issue, but my role in this would make sure that we get the resources and we would have something open within 24 hours to be able to vaccinate numerous people in this county. But we don't see that happening. So, right now, again, Chris and her staff is the incident commander on this, and we just play a resource role. As a matter of fact, emergency management now is, we've lived this since last year. And when it started off in March, it was rough going, and we worked close with public health and our emergency operations center for months, 7 days a week, trying to make sure we had things in place. And right now, what we're seeing is almost worse as far as negativity than we did when we saw in March. So it's been a long year, and we know it's not over. It's not close to being over. I will say this: I appreciate the citizens in our county that are masking up and doing what they're supposed to be doing. I've always said this: I look at hospital rates, I look at people in ICUs, the number of beds available, and those numbers are way down from where they were in November. I think November 16th was the high point in Iowa with over 1,500 hospitalizations, and I look today, and I believe that number is right around 400. So it's reduced dramatically, and so everybody needs to continue the good work, and hopefully, 2021 at some point will give everybody a break, and but everybody's got to do their part. So again, I'm a resource for Chris. Emergency management right now is very busy. We have a lot of stuff going on our end, and it's going to be severe weather season. So we're busy with a lot of other stuff. And when Chris needs us, she'll give us a call. But besides that, we leave it up to them to make their decisions on how they're going to handle out this. I consider we've been in response mode. We're still in response mode, but we're moving into a recovery mode. That's how I put it.
Great, thanks, Brett. I think the big takeaway that I heard you say was that if we get, for some reason, a lot of vaccines and we need to dispense quickly, we have a plan in place to get that done. So that's good to know. It's good for the community to know. Thank you very much for bringing that point out. Dee, anything different on the county level?
The county Board of Supervisors very much supports public health and emergency management in their efforts. And in the county buildings, we ask that people wear masks in the buildings. We also, as far as vaccines, understand the frustrations And we also get calls about that. However, it's less frustrating to not be able to get on a list than to be on a list and then have your appointment canceled because the public health hasn't received the vaccine. So we fully support what our county is doing.
Thank you, Dee. Really appreciate it. Penny, anything on the federal level that you want to share? Oh, you need to unmute.
There we go. Can you hear me?
Yeah.
Okay. All right. You know, we continue to monitor the situation and report back to Senator Grassley. So I would just encourage everyone, just to keep in touch. Any federal concerns that you have, with the exception, I know we'd all like more vaccines to come to the states. So I know that's been requested, and I think that will happen. Don't know exactly when, but I do believe that's on the horizon. But just to keep in contact with our office, you know, anything else of a federal nature matter, any concerns anyone has, to please reach out to our office. I had a great conversation with Chris yesterday, and I cover 13 counties out of the Davenport office, and just trying to keep in touch with all of my counties just to understand how the processes are working. Because we're getting a lot of inquiries from constituents. So I just appreciate giving me the chance to listen in too and find out, see where you're all at and what the processes are.
Great. Thank you, Penny, so much. And appreciate all your work you're doing at the federal level. At the city level, you know, our buildings are open. We do requiring masks, and I know it's a challenge, particularly at our park and recreation, our sportsplex center. It's frustrating for people, but we are just trying to keep the doors open. You know, we know we have various people who have various opinions about mask or no mask. And again, ask for your patience a little while longer for 2021. And you know, nobody likes the mask policy. I haven't found anybody that really loves it. You know, I mean, we want to get back to normal, but anyway, so that's the way it is now. And our city council meetings, you know, are not fully open to the public. If there is a need for you to be there, we have been allowing some people to come if they need to address the council or we have a report from somebody, but we are social distancing if you do come. But for the most part, be watching the Zoom connections or the live stream, unless you absolutely have a need to come to the city hall. I guess from here, does anybody have an additional comment that they thought of that they didn't share to begin with? Any additional thoughts? All righty. If not, I guess we'll end this. We appreciate everybody watching. This will be recorded, and Jason will have it out on the Fairfield Media YouTube, where people can watch it later this evening, tomorrow, whenever. And so again, please be patient. And overall, I think Fairfield's doing pretty good getting through this and helping each other out in different ways. I've seen a lot of great things that people have done for other people. So thank you for helping support each other emotionally, financially, food insecurity, all the things that people have been doing in our community. It's really, makes you feel warm and fuzzy to live here. That's all I can say. So again, thank you, Chris, Dr. Trent, Dee, Brett, Penny. Thanks for all your work that you're doing and keeping us informed. And again, we'll come to you again if we have really important information that we need to bring out. So at this time, we'll say goodbye, but keep watching Public Health. Chris will lead us. Thank you.
Thank you.